Hi, this is Dr. Richard Kimmel, and I wanted to address some issues that so many of our patients are concerned about. This video will review some of the overall vein concerns and what we can do in the setting of the COVID-19 pandemic. As this is an evolving situation and things can change rapidly, we may be updating this message at any time. So please check in with us on our website or on our Facebook page. Today is Tuesday, April 7th, and let's get started. First, I want to let everybody know that a lot of people are calling us, asking us about the symptoms of vein disease, how we diagnose their problems, and what underlying medical problems that there may be associated with the venous reflux. I don't really want to get too far into that because I already have nice videos on our website, and I would encourage you to go to the website and click on those videos to watch some more educational information that we've already posted. It's very important to all of us at the Kimmel Institute to educate our patients, because we believe that the best approach to treating patients is when they have a clear understanding of what we do and why we do it. In terms of vein disease and the COVID-19 pandemic, what you need to understand is that most vein problems are not life or limb threatening. Now, many patients may have significant pain or limitations in their daily lifestyle, but it is not common for somebody to have emergency vein problems. And I'm going to explain why this is so important in today's world in just a minute. The vast majority of what we do here at the Kimmel Institute is covered by insurance when patients are found to have symptomatic vein disease. However, this is done electively and not as an emergency. That's important because Florida's governor gave an executive order, and this will certainly affect your care. On March 1st, there was an executive order declaring a public health emergency. Just over a week later, on March 9th, there was an executive order in the state of Florida declaring the state a state of emergency. When that happens, the government has much expanded powers to be able to help the citizens. About a little over a week after that, on March 18th, both the federal government and CMS, the Center for Medicare and Medicaid Services, recommended limiting all non-essential elective medical and surgical procedures, along with the U.S. Surgeon General advising conservation of personal protection equipment and medical resources. So as a result of this federal recommendation, on March 18th here in Florida, Governor Ron DeSantis, by virtue of the authority vested in him through the Florida statutes, declared a mandate that will promulgate the executive order to take effect immediately. I'm going to now read the first part of this executive order verbatim, so that you understand a little bit about what we are legally allowed to do and not do during this state of emergency. So, all hospitals, ambulatory surgical centers, office surgery centers, dental, orthodontic, and endodontic offices, and other healthcare practitioners' offices in the state of Florida are prohibited from providing any medically unnecessary, non-urgent, or non-emergency procedure or surgery which, if delayed, does not place a patient's immediate health, safety, or well-being at risk, or, if delayed, will contribute to the worsening of a serious or life-threatening medical condition. Accordingly, all healthcare practitioners licensed in the state of Florida, including dentists, shall immediately cease performing these elective services. So what that means is, as of March 18th, most medical and surgical offices cannot perform anything other than emergency or urgent procedures. So, what does that mean for us and for you? What I'm going to go through now is what is considered a vein emergency and what should be treated urgently. A very good example of this would be sudden leg swelling that is frequently associated with pain, warmth, and limitation in mobility. This is very important to note that this is usually associated with a very sudden onset and is not something that you've noticed over the past several months. What our concern here with something like this is that it's a blood clot in the deep vein, or what we call a deep vein thrombosis, or DVT. A second urgent condition might be if you see a red, tender, swollen area on your leg, and sometimes associated with a streak, a red streak, up or down the leg. This is what we would refer to as a superficial thrombophlebitis, or a blood clot in the superficial veins. And while this isn't felt to be as serious as a deep vein blood clot that I just mentioned as the first condition, it certainly can be painful and needs to be treated. A third example would be a new area of ulceration or skin breakdown that's most commonly seen on the inside of your ankle that is rapidly enlarging. It may start as a small pinhole one day, and the next day it could be the size of a pea, and the next day it could be the size of a penny or a nickel. So this is something that can be rapidly progressive, and this is something that should be fairly urgently seen. In addition, if you have a sudden onset of bleeding from an area of your leg, maybe you have some bulging veins and you scraped it and you have some significant bleeding, some people in the past have gone to the emergency room immediately for this. While we don't recommend going to the emergency room right away, you should put pressure on it and stop the bleeding, elevate your leg, and get some help. But this is something that you may need to be seen for fairly urgently. So those four things are the kind of things that we would recommend seeing a patient for in our practice at this time. So the flip side to that is what's not considered urgent. And for that, we would start off by saying cosmetic veins. If you have spider veins, which look like tiny little spider veins or spider webs on your legs, and you've had them for a while and you don't like the way they look, we do a lot of cosmetic vein treatment. That's fine, but not during this state of emergency. Leg swelling that may have been present for many weeks or even months, that you're not happy with the way your legs look or feel, that's something that's not an emergency either. And in fact, during this emergency, when many of us are staying home, not getting out, not doing much exercise, not getting around, we may find that our legs are swelling a little bit more than usual. You may have vein disease or you may not have vein disease, but it is not uncommon to see the legs swell a little bit when you're doing a lot of sitting around. If you have bulging veins that have been present for quite some time, and again, not like the ones that are inflamed or clotted like a phlebitis that I mentioned, but just big bulging veins, they may hurt, they may ache, but this is not an emergency, and this is not something that we can treat legally based on the executive order from the governor at this time. And the other thing that a lot of people complain of when they come in is darkening of the skin around the ankle or the lower legs. Usually this is long-standing. It does not happen suddenly. It's been going on for months or years. And while this is likely due to an underlying vein problem, again, it is not an emergency and can wait. So with that being said, if we understand what the urgent or emergency conditions are that you should call us and come in for, and what the ones are that you can wait for, what can you do on your own while you're waiting for the pandemic to be over? Well, the best thing you can do is walk, because when you walk, there's a heel-toe strike that many of our patients have heard me talk about. And what that does is it squeezes the calf muscle every time you walk. That's called the calf muscle pump, which helps move the blood up through the veins in your legs. So walking is important to do. And I would caution you, if you are going to go out and take a walk, make sure you're following the social distancing, wearing a mask, and being very smart in this day and age, following the recommendations. Second thing you can do is elevate your legs. We don't expect you to sit on the couch all day with your legs up, but periodically throughout the day, and if you are sitting around watching TV or binging on Netflix, like we all are doing, elevate your legs. If you have surgical compression hose, wear the hose during the day, take them off at night. That will help keep your legs feeling better and limit the swelling that you're having as well. So where do we go from here? Well, if you're concerned that you may need urgent evaluation, please contact our office either with an email or a voicemail message. But it's important for you to state why you think you need to be seen and leave us both your phone number and your email address so that we can get back to you. Our office staff has a schedule to check the messages on a daily basis, and someone will get back to you just as soon as we can. But be patient, because we're not spending time in the office, and you're not going to necessarily get an instantaneous response. Our office hours are very limited and pretty much for administrative purposes only at this time, again, due to the executive order. Having said that, we are equipped to have a FaceTime or Zoom meeting if you would like to do telemedicine or have a virtual visit, and we can certainly schedule this to take place. You just need to let us know. When the executive order is relaxed and we're able to reopen the office, we're planning on announcing it both on social media and through emails to our patients. So for all of our patients who we have your email address and we send you occasional emails, keep an eye out for that when things start to relax a little bit and when we start to get beyond this state of emergency. For new patients, we encourage you to reach out as well and give us your contact information, and that we'll schedule a visit when we reopen. On behalf of the entire staff of the Kimmel Institute, we hope that you stay safe, that you follow your local health department recommendations for social distancing, hand washings, face coverings, shelter in place, and we look forward to seeing you when this emergency is behind us. Thank you very much, and take care.